I'm a techno babe.
Okay.
I can't even operate my own camera. Okay, here we go.
All right. But what we found is that sometimes you got different information. So this semester we decided to teach it all together in your lecture. And so we're doing it today with Module 2. Now, we talked yesterday after you all met with your adjunct teachers. We then met at 2 o'clock ourselves in a room so that we're all on the same page. This is how we grade this is how we grade that. So Professor Gray is filming this really for the use of those adjunct teachers who can't be here, that will be taking you, so they can hear exactly and explicitly what we require of you with the care plan. So you all got it in front of you, right? The one thing I forgot to tell you to bring, and maybe I hope some of you did, is remember the red folders the first day you got these cards? If you have them, take out the one that says Amanda, okay? Because we're going to be talking about that in a few minutes. Now, you know that we don't have a whole lot of time because of mosquito problems. So here we go. We're going to talk about this. This is your care plan. This is the plan. This carries the most points in clinical. The most points that you get in clinical, which is 10, you didn't change that, right, Professor Gray?
10.
10, is on this written care plan. So we're going to go over step by step what you need to do. Now, up there is your name. Nowhere on this paper or any other paper from that clinical will you have a patient name. Nowhere, okay? Because that's a violation of... All right, good. Zip up the lip up. So, no way do you put the patient's name on it. We're not interested in your patient's name. That doesn't concern us. I was telling some students yesterday, the only time I'll ask you your patient's name is when we're passing meds. I'm walking in with you, and I'll say, what's your patient's name? And they'll say, Mrs. Jones. And I'll walk in and I'll say, hi, Mrs. Jones, I'm Nancy. I'm the nursing instructor for the student, and I'm going to watch them pass meds, okay? That's the only time I'll ever ask their name. So on this paper or any other paper that you get from that clinical will never have the patient's name on it. And with that said, please don't let the nurses copy off parts of the chart. Even if they take the name off, you cannot take that out of the facility. Are we clear? Good. All right, so let's look at the top. It's probably easy peasy. Student name, care area, whatever area you're in, their sex, marital status, I really don't care about. Allergies is a very important thing, okay? So you need to write that down. Code status is a good thing that you need to know. Oh, okay, good. And if you want to, you can say where they came from, if you can find it somewhere in the record. Did they come to the facility from home? Did they come from the hospital? Did they come from another long-term care facility? That's what LTC is. So then you're just going to fill in the top. All right, now the next portion is med-surg diagnosis. Don't go by what we call the ICD code. Some of you in here might know what that means. Most of you probably don't. It's the coding system insurance companies and the federal government use to bill with. It doesn't make any sense to practitioners. It doesn't mean anything to us as practitioners. I want you to usually look at the very first admitting orders of the physician for the patient into the facility. They will put admit to long-term care, diagnosis of. That's where you need to find it. All right? If you have any trouble at all locating that, that's what your instructors are for. They're going to help you with that. If there is 2 or 3, write 2 or 3. This is the place for the medical diagnosis of the patient. Any questions? So far, all this information has to be gotten from the facility while you're there, correct? Okay. All right. Next, you're going to see this is divided in half on your paper, and you actually have a second page, I think, that just has this on it. This is the pathophysiology. Now, on the left side, it says textbook, and on the right side, it says patient signs and symptoms, correct? Or let's just look at the right side first. You've got a diagnosis up there you've got off of the chart. I want you to find the signs and symptoms that the patient came into the facility with. So if I said emphysema, what would be some of the signs and symptoms you all might think you would find? Yes? Shortness of breath. What else?
Tired.
I'm sorry?
Tired.
Tired. Lethargic maybe.
Coughing.
Coughing productively. Lung sounds would be what?
Wheezing.
Maybe bronchi, right? We talked about that yesterday, that bronchi sound, that coarse sound. Yeah. What else? They could be wheezing. Did I hear that? Yeah, it could be wheezing. Oh, okay. Hold that. No. There's a reason I tell you to hold that. We'll get to that under NANDA. But you're going to have to show me an arterial blood gas, and you're not quite there yet if you want to use alteration and gas exchange. All right, so signs and symptoms will go there. Do you find that in the facility, in the chart? You betcha. So all this I want you to be writing down. I have to find this where I'm working at. Now let's look over to the left side. Textbook disease process. This is where you go home, and this is what you do at home. You're going to take your, oh yes, you have to take the plastic off the Lewis now. I'm sorry, true story. You're going to look in your med-surg book that we use called Lewis, that hopefully came in your bundle. You're going to take the cellophane off, and you're going to open it up, and now you're going to start utilizing it. So you're going to look up the pathophysiology of whatever disease process there is, and you will not copy and paste, because that's plagiarism, and we don't want to do that, correct? You don't want us to run this thing through Turnitin, right? So what you're going to do is you're going to read it, and you're going to put it in your own words. Now, to many of you, these things are going to be extremely foreign. We understand that. It's okay. But we want to see just how much you read and really understand. All right? And then we will help you correct it or say, hey, you're spot on. All right? But it has to be in your own words. This information needs to come from Lewis, your med-surg textbook, and that part is done at home. And I ask my students to identify 2 disease processes. Sometimes they'll, these older people, they can have 8 or 9 diagnoses, and we'll take 2 of the most current, okay, not 8 or 9. But I do like to see my students identify pathophysiology of 2 disease processes. Now, your clinical instructor might have you do something different with that. They might want 1, they might want 3, but they have academic freedom to do as they choose, okay? Because we all know that you all get back together and you talk, oh, I only had to do 1. Oh, I had to do 3. Oh, all right, there's academic freedom, and the more work that you do and the more that you look these things up, the more you're going to know, all right? So, again, this is academic freedom, and those instructors are free to tell you how many to do. Got it? Okay. All right, let's go down here. Thank you for enlarging this.
Yeah, I can read it now.
Yeah. So you see there's 2 pages to that thing. And then we come to the patient health history. And, the directions are really here. And it says, in your own words, summarize relevant components of the patient's health history and the review of systems. Have you discussed with them history of present illness, history of past illness, and review of systems?
I mentioned review of systems that it was subjective.
Okay, great. Thank you. All right. Patient health history has 2 parts. There is a history of the present illness. So in other words, they came in because of something, all right? So let's just say we're in acute care and they came in with an acute MI, and that is what? A heart attack, okay? So they came in with an acute MI. So the history of the present illness is anything related to what happened to them at home that caused them to come to the hospital. All right? Maybe they had crushing chest pain. Maybe they were really short of breath. Maybe they passed out. Maybe they felt their chest beating really hard. Maybe they got diaphoretic. All right? Do you understand? That is the history of the present illness. Okay? Then the second part to this is history of past illness. So maybe this guy that had the MI, maybe he also has diabetes. Maybe he has hepatic disease, which is the liver. Okay, so maybe he has osteoporosis. I don't know, but that is not a history of what's happening now. It is a history of what has happened in the past. All right? And it is very relevant, by the way. So, history of the present and history of the past, both will play into this person's condition and care. So we need to know both. Is there anybody that doesn't understand the difference in the two? And I'll try to explain it in a different way. Do you all understand that? History of present illness, history of past illness. The third part of this is review of systems that Professor Nelson taught you about. Every one of you, I don't even need a show of hands, when you've gone to the doctor for any reason, you get this paper that says, do you have diabetes, heart disease, bleeding problems, headache, migraine, right? And you're going, da, 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 and you're checking it, right? That is a review of systems. That's why it's subjective, because is the physician doing this or are you doing this? You are. Okay? You could say, no, I don't smoke when you just put one outside before you walk in. Right, really, right? No, I don't smoke. I just put it out, I don't smoke. So it is subjective. And that's what she meant by the review of systems is subjective. The physical exam that follows that is what? Objective, because that's when you're actually putting your stethoscope on people, or the pin light and all that stuff we talked about in lab yesterday. You're putting your hands on them, listening to their heart, lungs, their abdomen, feeling their pulses, checking their pupils. Is that objective or subjective? That's objective stuff. Got the difference? Okay. So in this section, we need to see you write the history of the present illness, the history of the past illness, and a review of systems. You will usually find this in an H&P section of the chart, whether the chart is paper or the chart is on the computer. You want to look at the H&P section, and this is usually where you find it. So therefore, are you going to do this information at home or at the facility? At the facility. So you see what you need to do there?
Stop. Are you done with this section? Okay, let me